We're going to close up the infectious disease chapter with arthropod infestations. And the classic one is going to be scabies. The mites, the scabies mites, like to burrow under the skin. And one of the hallmarks of scabies infestation is pruritus. It just itches and itches and itches. In younger children, it can sometimes mimic an atopic dermatitis because that also is an allergic response, but they also itch with that. And sometimes the rashes look similar. But look for burrows in the patient and on the test. They will cause the burrows you'll see sometimes on the webs of the fingers and on the wrists. There is a differentiation. Infants who have scabies will be affected on the face, but older children, it is basically from the neck down, and the face and scalp will be spared, same as with adults. The diagnosis can be made by doing a skin scraping of a burrow or a nice vesicular lesion. Put a little bit of mineral oil on that area, scrape it with a scalpel, put it on your slide and look at it under the microscope, and you will see the scabies mite. The treatment includes permethrin. It usually comes in as a lotion. You work it onto the patient from the neck down, leave it on overnight, wash it off, and they're fine. They may have some itching for the next few days simply because the mites are now dead, and that can create a bit of an inflammatory response, and they might itch from that, and so some antihistamines may be helpful in that case. But usually the permethrin cream or ointment takes care of the disease, and you should consider treating the entire family. Lindane is an alternative but should not be used in children because of the potential for neurotoxicity. And here is a scabies mite. These like to burrow under the skin, and there the arrow is pointing at a burrow. Always look for the web parts of the fingers and also of the toes for the burrows. The next one is the lice family, and there's different kinds of pediculosis. The only one that serves as a vector for human disease is the pediculosis humanus corporis, which is also known as the body louse. And again, the hallmark here is itch. So they'll have pruritus. This is associated with poor hygiene. It is transmitted on contaminated clothing and bedding. And these patients will just scratch. The treatment is to improve hygiene. Head lice, these will live close to the scalp. However, they lay their eggs, and so many times what you see are the eggs. They're also called nits. If you have long hair and you can see eggs way out here, it means that you've had a pretty long infestation because the eggs are laid close to the scalp, and as the hair grows, then you see the nits, and usually those are empty egg casings. You can see them with your eye, actually, and you can look at them under the microscope if you'd like. The treatment is going to be malathion or permethrin cream. Here you see the head louse, not actual size. This is something that is used, the fine tooth comb. So typically when you use the treatments, you will put it on and then leave it on overnight, shampoo, wash it off. But most schools have what's called a no-nit policy. Now the permethrins will kill the eggs, but schools have a no-egg policy, and that's what the comb is for. The comb helps you to comb out all of the eggs and get them out. The next one is pediculosis pubis, which is mostly seen in adolescents. This is skin-to-skin sexual contact. Again, it can cause pruritus and some excoriation from scratching. You can see the nits, and the treatment will also be with permethrin. This is the pediculosis pubis. And that's what that one looks like, the pubic louse.